All right.
I got the notification. All right. Hi, everybody. Thank you so much for your interest in the Leadership, Analytics, and Innovation program. My name is Katie. I'm part of the recruiting and admissions team at the University of Michigan School of Nursing, and I'm joined by Dr. Barb Medbeck, who is the program lead for the Leadership MSN program, who will go over some more information, hopefully answer a lot of the questions that you have. Of course, if you think of questions later, you can always contact myself in the admissions office or Dr. Medbeck as well if you have questions about the program. But yes, we will give you some more information. And with that, I will give it to Dr. Medbeck.
Great. Thanks, Katie. Welcome, everybody. And thanks for joining us today. I'm going to share my screen and share a little slide deck with you. We're excited to share the Leadership, Analytics, and Innovation program with you. And let me just do a screen check. Can you see my screen okay?
Yes, I can see it.
Okay, great. Thanks for that. So welcome to Considering the University of Michigan School of Nursing. As we go into this webinar, thank you everybody for muting your mics, but please feel free to ask questions. I've allowed time towards the end so that we can do this, and phone numbers for both Katie's team and myself so that you can reach us in any way possible to get your questions answered. So we want to welcome you to looking at this graduate program. You've already been welcomed by Katie. I'm going to do a brief introduction about me. Today, I want to talk to you a little bit about what we're seeing going on in the industry, career opportunities, and why we're really talking about leadership, analytics, and innovation. We'll go over the curriculum very quickly, talk about any of our program objectives and details, and we'll end with application information. So by the end of our session today, about 35 minutes, you should have everything you need to complete an application and really consider the University of Michigan School of Nursing for your next educational endeavor. I am a doctor of nursing practice. I'm also credentialed through the ANCC as an executive nursing leader. I have spent the majority of my career in executive leadership as both CEO, president, and CNO of multi-system organizations. I came to the University of Michigan about 4 or 5 years ago, and I'm currently a clinical assistant professor, and I have the privilege of serving as the program lead for the LAI Master's program. Now, the LAI Master's program was just reintroduced as a fully digital, fully online program really 2 academic years ago. We are just in our 3rd academic year. We are a part of one of the 2 departments within the School of Nursing, and the department that I live in is Systems, Populations, and Leadership. And that really has faculty from both nursing and non-nursing in the department that are looking at bigger picture issues, bigger systems, how groups of people react and respond, populations do, how organizations and organizational change occurs. My focus area in my scholarship since joining the School of Nursing has been dealing with workforce, big topic these days, burnout, digital learning, which you'll hear about in this program. I do a lot in leadership development of virtual reality. So using virtual reality and different types of media that can immerse you into a leadership experience without having to be there for the first time and be in the room. So it gives you that chance to develop and build new competencies. And first and foremost, I focus on quality and safety. I teach both in our graduate master's program and our graduate DNP program. And here are some of the ways you can reach me. There'll be more at the end. So as you start to think about the industry and what's going on, you know that COVID-19 has dramatically created this great resignation. And while I hate to talk about it, we all are experiencing it with staffing shortages, staffing changes across organizations in healthcare, really across all organizations. And we've seen through COVID that nurses have been able to step up and really perform, not only from bedside to boardroom, as they've innovated how we look at healthcare and how we provide healthcare in this post-pandemic era. we have seen in action over the last several years, nurses who are action oriented, who have the ability to manage and synthesize data. And these nurses who have innovation skills, ability to look at action orientation, ability to understand the work of frontline all the way to leadership roles are the nurses that are really being pulled into leadership and innovation and analytic programs today. So the focus of the LAI program is to build next generation nurses that are really going to be able to take from the retiring nurses and those that have left the great pearls of wisdom and improvements and quality and safety and deliver care, but apply innovation in ways that we haven't seen yet, and to really elevate the practice of nursing as we continue to move forward in this new post-pandemic era. Here are some of the skills that we continue to hear from our stakeholders that are necessary for leaders that are coming into any level of healthcare today. They're looking for action orientation, focus and improvement, quality and safety, ability to understand business and strategic planning, understanding analytics and decision making, building interprofessional teams and the ability to lead those teams, as well as being able to apply principles of innovation, being able to be persistent with change and the pace of change, and then being able to communicate and lead with executive presence, both within the organizations and external to the organizations. I've heard a lot of people say, well, you know, there's downturns, people aren't hiring. And at this point, what I see are many people who are being hired into positions who may or may not feel that they're ready to go into those positions, that they feel competent in their positions. And in this post-COVID arena where we have definitely experienced sometimes where we were letting staff go because we didn't have care. That wave has definitely changed, and really the high volume of care, the demand for service delivery is really putting a stress on the systems, on staff that are currently working, and really has a high demand for leadership. So where are the new opportunities? We're seeing them come out of industry, in technology companies, in informatics companies, in insurance, and most recently in remote care and remote management. As we know, in COVID, we were able to move telemedicine and telehealth ahead much more quickly than if we had just been moving along at our regular pace of innovation. And so remote care is really something that's being launched very much across the country as a new delivery model, and something that we're seeing a lot of new leadership opportunities. Of course, there are opportunities in traditional models of care, from, you know, offices to hospitals to post-acute and long-term care. There are also growing needs for nurses who can interpret policy and engage in public health policy and practice development. We've got a lot of evolving roles that are coming around, especially when it comes to patient and family focus. You're seeing chief patient and family wellness officers, chief clinical officers, lots of different roles that are evolving, but very much focused on the patient as the center of the care delivery hub. Finally, new leadership options are coming up all the time. I can't even keep track of the titles these days. And as we also know, many nurses in advanced practice are moving into education and teaching, as now my academic colleagues across the country are becoming the oldest group of nurses in practice, currently with, I think, an average age sitting around 58 or 59. So moving into academic education as well as professional development and training and leading those programs is another area where we're experiencing gaps. So lots is going on in the hiring area. Here's just a quick summary of titles. They look pretty straightforward, don't they? Coordinator, educator, manager, supervisor, specialist, director. But what I can share with you is that the titles are constantly evolving. We've already talked about some of the newer areas, both in informatics in innovation, in industry, but I would say that roles are really emerging across the continuum. We're seeing a growth in the post-acute care area, primarily because those nurses are seeking graduate education now as the care and the skills needed to lead and manage those very important aging and aging in place programs, as well as long-term and post-acute care, are growing by leaps and bounds as more and more people are managing their care out of the traditional inpatient acute healthcare regime. Care management, case management, quality, safety, risk, all areas of focus, excuse me for a minute, as well as population focuses, public health, home care, school nursing, all of the continuum of care are really seeing gaps in leadership, and you're seeing opportunities evolve in all of those areas. And we've already talked about health policy and advocacy, where we've had a number of our students who've graduated the program really move into those areas. So why would you consider the University of Michigan? Well, first of all, according to both the first and the second Future of Nursing study, nurses are needed to transform care. So as you consider upgrading your education to that next level of graduate study, who better than you to help transform care? In addition, we know that the Future of Nursing report shared that we really need to have nurses across all areas as full partners so that we can really lead the changes, address health equity, look at healthcare redesign and population health. And you are really seeing that evolve now as we focus so heavily on what we learned out of COVID-19 with health equity and what we're seeing in terms of gaps in care delivery as we look at that post-acute care world. Another reason to consider the University of Michigan is that we are one of the top schools across the country as rated in US News and World Reports. And our graduate study programs at the School of Nursing are currently ranked 8th in the country. So while we have a strong research focus, and you can see the many areas that we have focus in, our faculty are really dedicated to working with students, engaging with students, so that as you come to the program, see an area of interest that you have, let's just say workforce. And as you find faculty who have that same interests like myself, we welcome you into working with our research, working with our activities, and really becoming a full partner and part of the School of Nursing. And that's what's different between graduate school and undergraduate school. We see, and our department sees, developing our master's and our doctoral students as really something that will help continue the longevity of nursing across the continuum as we move forward. Our stakeholders have said lots of great things about the program. I can share with you that they are still looking for people who can apply knowledge, demonstrate creativity and innovation, who can use strategic thinking and business planning, who can understand financials and learn and partner with chief financial officers. They're continuing to look for people who have a focus in data and analysis and interpretation of data. And that's one of the things the LAI program has really heavily developed, is that analytic focus and informatics focus and information and an innovation focus in addition to leadership. They really are looking for leaders who can apply and leverage evidence-based practice, who have confidence in their communication and leading skills, and who are really willing to step up and fill creatively the gaps that are identified. Now, let me be really clear. It's important for you to know that not every person who comes to the LAI program is looking to be a CNO, is looking to be a unit leader, but they are looking to exhibit and to use leadership skills in the areas of interest and the practice paths that they've chosen. So it doesn't have to be a formal role, but it is that skill set that you need to continue to progress in your career. This just shows you that we are focused on developing data-driven, innovative nursing leaders. We have surrounded that focus in this program with things like analytics and technology and informatics, strategy, operations. And on the outer corners, you see innovation, complexity, interprofessional care delivery, and patient and population-centered care. And those are all the boundaries that we have within the School of Nursing that we really infuse across our entire curriculum. Here's what the curriculum looks like. It's 34 credits. And of course, it wouldn't be me doing a program if I didn't go a little maize and blue on you. So here's a little maize, here's a little blue. Those things in the blue are called core curriculum. And you can see in each of the columns, there's about 3 courses. They range from 7 to 9 credits across all of those courses in that column. So if you were coming into the program as a full-time student, you might be taking for the first semester HS 700, Nursing 504, Nursing 509. That would be about 9 credits for that semester. In a couple of our semesters, you have 7 credits or less. And as you move into a longer term program, you take less of the courses over each of the semesters. In addition, we have what we call individualized courses, where we'll work with you to set the trajectory. And those include doing 224 hours in a clinical placement that's called N782 for the technically interested folks. But what it really is you working at the elbow with an executive or executive nurse leader for 224 hours, where you're working with them in their projects, in their environment, and really learning from them. Many graduate students at the master's level find that they can do that within their local area and within their local organization. And you may have somebody already in mind that you'd like to work with and follow and learn from. Let me just point out that one of the differences with the University of Michigan School of Nursing here in Ann Arbor is that we have an Office of Clinical Placement who will work with you, and between you, myself, and the Office of Placement, we will establish where that practicum is going to be, what you want, who you want to work with, what you want to learn, and we will then set that up for you. So it's not a situation where you have to find your practicum, and you can do the practicum basically after you have completed 6 of the blue or the core courses. So you can be doing that as early as your 3rd semester in the program. Finally, there are 6 elective credits which you can take from the School of Nursing. We have a number of great elective programs, but you can also, as I say, go shopping within the university catalog and select programs that are throughout the university. I have students who will go to Ross School of Business, School of Information, School of Public Health, Social Work, even College of Engineering, and really find courses that they want to use to tailor as an elective for the career trajectory that they have put themselves on. So we will work and talk about both the immersion, that N782 course, as well as those elective credits in your first semester when you join the Michigan program. So just as a key recap, 34 credits, 28 are in core credits, or those blue, 6 credits are really in the electives side of it. And remember that one maze course, the immersion, is required. So we counted in our core credits, but it is something that we set up very individually for you. The program is delivered fully online. There may be occasional synchronous or at a certain time and place class meetings. Those are all recorded so that if you're unable to join or make those course presentations, you're able to review them at your own pace. So a digital format for you to do on your own time as you balance homework and then school. We do have an annual intensive. It's called the 4-day intensive, where once during your entire curriculum at the University of Michigan, you're invited to campus. And during that course, usually it's in mid-May, during that 4-day experience, you'll be exposed to interactions, simulations, innovations, and approaches that we can't really teach by a digital path, but we can do that in a simulated format. For you coming to that 4-day intensive. We will give you 24 hours towards that 224 hours in that immersion with an executive that you'll work with at the elbow. So you typically will come in your first, second, or third year to the intensive whenever you can fit it into your schedule. We have all the details. We have hoteling. We have all the information ready for you. And we have a great time during that bonding. So people you've been working with and talking with in groups, in classes, in orientation, you can finally meet and bond with and create those lifelong relationships that happen as a part of your graduate studies. We've already talked about how our department focuses in analytics, leadership, innovation, and informatics. But I wanted to just say that one of the perks of coming to the School of Nursing's master's program is you have available to you a selection of several certificates that you may be able to participate in if you're interested. So we have a certificate in health informatics, in education, in global health, and we also have a concentration jointly with the School of Public Health in occupational health. So in all of these areas, you can, for maybe 1, 2, 3 credits, or maybe one additional class and some additional time with faculty, pick up an extra certificate that you can use as a part of your career path and where you want to go. Last thing I'll share here is that we've built all of our courses back in the program here, all of our blue courses, very specifically. We've built those all with you becoming certified either through the ANCC as a nursing executive or AONL as a nursing leader. And so we include all of the concepts, all of the time that you're spending in courses will get you ready to apply to take those credentialing exams. And while you still have to study and pass the exam, you will have had the exposure to all the material that's in those exams and required for a certification or a credentialing outside of the University of Michigan. So this is what our classes look like. We come together virtually. We've gotten pretty adept at Zoom. People will form cohorts and create colleagues in groups as they know it. They'll set up some separate Facebook groups. We have ongoing monthly kind of coffee hours and happy hours so that we can connect, make any course corrections, changes, continue to improve the program, continue to support you. One of the things that's come up as we've moved to a digital program, especially since we launched this during COVID, is, well, this is going to be easier than the regular University of Michigan campus. There aren't going to be as many resources available. Those are things we've heard. Let me just say loud and clear that we've worked really hard to make sure that our masters in leadership analytics and innovation is equally on par with all of our other core classes at the School of Nursing and across the university. So you're going to still find the same challenges and the same information and the same quality of courses that you come to expect from the university. In addition to that, you can expect the resources to be similar. So if we have a writing workshop, if we have a writing center, which we do at the university, those as well as the library resources and the connected learning resources, all of those are available to you as a remote student. So you have the same resources and the same availability of information to you in addition to access to faculty. So here are our 2 admission cycles. We have an admission cycle for fall of 2023. Our first, and I should say that we run early admissions all the way through the year. So the earlier you get your application in, the sooner we can review it, hopefully approve it, and offer you a seat in the program. But you can see this is our final deadline for June, and our classes will start at the end of August. I think that date is off by just a day, so I apologize for that. And then our winter cohort begins in January each year, We've got early deadlines, but again, we're accepting applications for that cohort that begins in January of 2024, about a year from now. The final deadline for that is in October. And you start in early January, right after the new year. So those are our 2 cohort cycles. But again, we're always accepting applications and admissions as kind of a rolling enrollment, if you will.
Just a quick note about the deadline. Sorry, Barb. I think the deadline for winter 2024 is going to be October 1st. Still plenty of time, obviously, but just a little tweak this year. Just October 1st instead of the 15th.
Thanks very much. Yep,
still
so
October
1st. And we'll make a change to this slide before we send it out to folks. But I appreciate that update, Katie. Application requirements, and Katie, please feel free to jump in here. But you are going to be asked to create a nursing CAS account. You'll be asked to send transcripts from any of your post-secondary institutions that you've graduated from or went to school with. You'll be asked to get 3 recommendations, letters of recommendation, which can be uploaded into that nursing CAS application account. And 2 of those we always suggest come from nurses that have a higher level degree than yourself. You're going to be asked to add a resume or a CV. We're going to ask you for a personal statement, because that's a bit of how we learn what you're thinking about this program and how it is and what you want to accomplish as you come into the Leadership, Analytics, and Innovation program. And then as we move through the application review and the review cycle, you'll be asked to also do a Cura assessment interview, which is a series of online questions that you'll record over a timed amount of period. And Katie, you can tell me how long that is. And you'll submit those online as you move through your application process. Katie, is there anything you want to add to this?
No, that was great. Just a couple notes about the Cura assessment. It is a strange kind of process that nurses in particular are not familiar with. So that can be a little strange, but you can practice. Cura, the software system, allows you to set up your account and you can get comfortable with the system. They'll just, ask you some randomly generated questions so you can get used to responding to them and recording yourself and kind of not really talking to anybody except for your computer screen. So there is ample time. You get 7 days, so you can practice whenever you like. And then once you sit down to actually do it, you do have to go start to finish. Takes maybe 20 to 30 minutes, and you get 90 seconds to respond to each question. But it's a really great tool that we found, especially with the program being online. It's very convenient for students. They can do it, when it's most convenient for them within the 7 days. And then, of course, I definitely recommend taking advantage of being able to practice before you actually start it. So it usually is not a problem. Of course, if you have questions, you can let me know.
Thanks, Katie, for that. And Cura is a little different, but it's kind of fun. It lets us see a picture of you and how you're answering questions and thinking about your graduate education. So it gives us a little insight into you without having to do that face-to-face interview right off the bat. As we wrap up today, I'd like to offer, please ask any questions, and Katie may have a couple of questions she's going to ask me about. If you want to know more about the LAI program, go to the website online.nursing.umich.edu, and you can go into the program plans for the plans of study you might be doing. Excuse me, I don't know where that's coming from. And you also can look at some videos from myself as well as some students. I guess it's a sign that you've talked too much when you start to get hiccups. If you want to just understand our school even more, please feel free to just go to the nursing website for the School of Nursing, nursing.umich.edu. Our graduate admission advisors are great, and you can reach them via email, and their email and phone number are listed in all of the websites that are noted above. And you always have that opportunity to reach out to me as well. So with that, I will do some questions if anybody's got questions, or Katie, if you've got anything you want to, test me out on, feel free to go ahead.
Sure. One of the biggest questions we get, and maybe you have some insight into what current students are really doing, is about working. How much can I work in the full-time curriculum as opposed to like the part-time curriculum? How much do students work generally? So I'm not sure, especially since the pandemic, has that changed at all, or are students still being able to work just as much?
Yeah, really great question. So let me answer it in three parts. The first part is, yes, we've built the program so that you can work. The second part is about 98% of our LAI students are working at least 30 hours or more in the program, in their current areas of work. And my final comment is that while you've got to balance everything, and going back to graduate school is always going to pose a challenge, one of the things that we've learned over the last 2 years that we've been teaching the digital education program is that almost always, as soon as you get into the program, students are getting a new promotion or they're finding a new job. That's before they graduate. So it is always a balancing act, but with the pandemic, the demand for leaders has really pushed nurses who are interested in leadership, analytics, or innovation to get out and get into the program early. So it can be done. We've done that work to plan for a balance between your family life, your work life, and school life, but it does take focus and organization on your part as well.
That's usually another question we get is, how much about balance and making sure you have your family life, your social life, and faculty have always been really great, including this program, to make sure that not only are you getting the good experience about going to school and all that exciting stuff, but that you also maybe have a life outside of it and find that balance. So I find students report that to me as well. One of the other questions we get really is about the online, which you kind of addressed before. And there was an outcome survey a couple of years ago that came out about what students were feeling about the online programs and how easy were they to navigate and their content. And that was actually a really great response. I think it was 85 to over 90% had positive things to say about the experience. But that's the other thing we get, is how, when this program moved online, how is it different from, like, say, an on-campus experience or the online experience, and how robust is the online experience? Is it the same as the on-campus?
The online experience is very robust. So for each credit that we've built for you to take, we expect that you're putting about 3 hours of work, either in reading class or assignments per credit hour in place. So for example, if I'm taking a 3 credit hour course, that means you've got 8 to 9 hours of work to do for that course during that week. And weeks may vary, but we've worked really hard to balance the workload across the semesters. We have a very similar model of how courses are presented, so you don't have to learn new software every single semester. And we have done something called scaffolding, where we add concepts, and as we add them, we repeat concepts with courses. So you're not getting redundant information as much as you're getting information about how you can leverage these tools differently. Is it doable? Absolutely. Do you need to organize yourself? Yes. So we always say, plan a space that's just your own for school. You'll get an opportunity to ask more people for help, maybe reassign some of that dusting or some of that grocery shopping or dinner making to other people in the family. So there's lots of ways, and we have lots of tips in both our orientation modules and in our orientation sessions about how to balance. But then you've got the work of groups that you're in, as well as colleagues that are in the program. And those are some of the best lessons. When you go to our website, you'll see a couple of those testimonials, and you'll see other students and how they've worked through those types of situations. Any other questions? If not, I think we can call this one to a close today. We're really happy that you joined us. Excited that you're considering our program. Really and truly, please reach out if you have questions with the Nursing CAS application, any questions about the program. You see the emails. We're more than willing to help you. And we really want you to consider joining us at the School of Nursing here in Ann Arbor at the University of Michigan. We're proud of what our digital education program is doing. We're really proud of what our LAI graduates are doing now, and we're excited to share those opportunities with you, as well as our faculty to learn and grow from what you bring to the program. With that, I'll stop sharing. Katie, any last words?
No, just thank you so much. Thank you, Dr. Medbeck, for sharing all the great information about the program. I've heard from graduates, they have nothing but really positive, great things to say, and the things that they're doing out in the field. And we have graduates in almost every state. It's pretty amazing. So it's definitely nationwide that we have alumni, and that I see them when I travel and things like that for events. So thank you so much for sharing that information. And again, stay in contact with us if you do have any questions. We're here to help. Not a bother at all. Feel free to reach out to me, give me a call, email. I'm happy to help, and hopefully we see your application soon. Thank you so much, everyone.
Thanks, everybody. Go Blue.
Go Blue.